Hey everyone, welcome back to Breaking Down Nursing. If you're getting ready to take the NCLEX, there's a good chance your anxiety isn't just about the content. It's about not knowing what it's going to feel like. So in this video, I'm going to walk you through exactly what to expect on NCLEX test day. From checking into the testing center, all the way to what the questions actually feel like while you're sitting there taking the exam. And honestly, a lot of students are surprised by the NCLEX because it feels very different from nursing school exams. So let's break it down. First, expect the NCLEX to feel hard. One of the biggest mistakes students make is assuming that they're failing because the questions feel difficult. The NCLEX is designed to challenge you. You're not supposed to walk out feeling confident. Most students leave the testing center convinced they failed, even the ones who passed. Why? Because the exam adapts to your performance. As you answer questions correctly, the computer gives you harder questions to determine your safety level as a future nurse. So if the questions feel difficult, vague, or priority heavy, that can actually be a good sign. Expect priority questions. The NCLEX is not a memorization exam. It's a safety exam. The test wants to know, can you keep a patient alive? Can you recognize emergencies? Can you prioritize correctly? Can you delegate safely? Can you identify what matters most? You'll notice many questions involve ABCs, safety, delegation, infection control, patient education, priority interventions, and therapeutic communication. You may know all the disease processes in the world, but if you can't prioritize, the NCLEX will expose that weakness very quickly. Expect questions where multiple answers look correct. This frustrates many students, including myself. On the NCLEX, you'll often narrow it down to two answers that both sound reasonable. That's intentional. The exam is testing whether you can correctly identify the most urgent, the most safe, the best response, the priority action. This is why understanding the nursing framework matters. ABCs, Maslow's hierarchy of needs, acute versus chronic, stable versus unstable, expected versus unexpected. These frameworks help you separate good answers from the best answers. Expect case studies. The Next Gen NCLEX introduced more case study style questions. You may see things like lab trends and patient charts and vital signs, nursing notes, provider orders, medication records. You'll need to think like a real nurse. Sometimes you won't even know the diagnosis immediately. Instead, you'll need to recognize patterns and determine what is dangerous. This is why critical thinking matters more than memorization. Expect SATA questions. You're likely to see multiple select all to apply questions, which are always our favorite, right? The good news, these questions now often give partial credit. That means you do not necessarily lose the entire question if you miss one option. Still, SATA questions require careful reading. Students commonly miss them because they rush, they overthink too much, or as I like to call it, play the what if game, add assumptions, and ignore keywords like first, best, or immediate. Slow down and treat each answer choice like a true or false statement. Expect fatigue. The NCLEX is mentally exhausting. Even strong students can start making careless mistakes later in the exam. That's why things like sleep matters, hydration matters, pacing yourself matters. If your brain starts spiraling after a difficult question, reset mentally and move on. You can't change previous answers. One bad question does not determine whether you pass or fail. So take each question as a new challenge. Expect questions you've never seen before. This surprises many students. You may see medications you don't recognize, diseases you barely studied, equipment you've never used, but don't panic. The NCLEX often gives enough clues to help you reason through the question safely. Again, focus on what really matters. Patient safety, side effects, nursing priorities, dangerous findings, expected versus unexpected symptoms. The exam is testing judgment, not perfect memorization. What the testing center is really like. When you arrive, you'll check in, provide identification to prove that it is you. Store personal items. Highly recommend not take anything valuable into the testing center itself. You'll possibly get scanned with a metal detector depending on your testing center, and you'll receive a whiteboard or erasable note sheet to take notes during the exam. The environment is usually quiet and highly monitored. You may wear things like headphones or earplugs to help you drown out the noise. Once the exam starts, focus only on the question in front of you. Don't think about how many questions you've received. The number does not predict whether you passed. Some final advice. The NCLEX is not asking, are you a perfect nurse? It's asking, are you safe enough to begin practice? That mind shift changes everything. You do not need a perfect score. You don't need to know every disease. You need to be able to think safely, prioritize correctly, and stay calm under pressure. And remember, feeling uncertain during the NCLEX is normal. If this video helped you, make sure to subscribe to the Breaking Down Nursing for more NCLEX review, Next Gen NCLEX strategies, and difficult practice questions. And drop a comment below. What part of the NCLEX makes you the most nervous? As always, thanks for watching and stay safe.